Hi, my name is Allie McKee and I'm here to talk to you with my colleague Melissa T about a therapy called interferential current. Interferential current, IFC for short, is a pain control modality that helps to reduce swelling and also promote localized healing. IFC is commonly used in physiotherapy clinics but can also be used by doctors and massage therapists alike. Many therapists like this technique because it is safe, non-invasive, non-addictive, and it's also non-pharmacological. So it's very good in dealing with pain, especially chronic pain.
I'm going to show you interferential current therapy. There are several indications for it. The one we're going to show you is the indication for pain. There are several contraindications for it, and those include pregnancy, having an implanted electrical pacing device, cardiac arrhythmia, placing your electrodes over the carotid sinus area, or if your patient is hypersensitive.
Okay, so the first thing you want to make sure you do is use an alcohol wipe to clean the area. So we're going to do these one. So we have our machine here, and we put it on the IFC setting, and we left all settings the same. Because for pain, you want it from 80 to 150 hertz, which we're going to do. If you were doing edema, you'd want it 1 to 10 hertz, and if you were doing muscle rehab, you would want 20 to 50 hertz. But this was already set on 80 to 150, so we're moving there. Another important thing with IFC is you need to make sure that the channels are crossing. So I have one channel and Sarah has the other, so they need to be like channel 1 crossing this way and channel 2 crossing that way, so that the currents are going to crisscross. So I'll put mine over here, and Sarah's going to crisscross hers with mine. You also need to make sure that the electrodes are at least 1 electrode width apart from each other in all directions. So now we have Kate set up, and her pain would be like in the middle of the 4, so we're surrounding her area of pain. So then we'll start turning up the intensity, and you want the intensity a strong sensation for the patient, but no muscle twitching, so you want to make sure it's still comfortable for them. So Kate, just tell me when you feel it and tell me when.
My name is Melissa, and today I'm here to talk to you about the indications and benefits of IFC therapy. So one of the indications for the use of interferential therapy would be for patients who have chronic pain or an acute injury. The benefit would be that it relieves pain, and how they believe that it does this is through the pain gate mechanism. And so there's large nerve fibers, and then there's also small nerve fibers. And the small nerve fibers are the ones that perceive pain stimulus, and the large ones are the ones that perceive touch, pressure, that kind of sensory information. So both of those informations travel to the dorsal horn. When there is interferential stimulation, that stimulates the large nerve fibers, so it inhibits the painful nerve fibers, which are the small ones. In that way, the patient, it helps to relieve pain. Another indication for the use of IFC would be patients who have swelling, or patients who have issues with circulation, or an injury that is reluctant to heal. What the therapy does is wherever you put the electrodes, it causes local circulation and blood vessels to vasodilate. And you know that with vasodilation, when blood comes, it comes and clears all the waste in the area and the damaged tissue, and it also brings in new nutrients.
IFC can also be used to help promote muscle stimulation. So there's a setting on the machine that can actually stimulate muscles to contract. So this is helpful for patients who are unable to contract their muscles voluntarily. So this is the case often in stroke patients or post-spinal cord injuries, where the patient actually can't get that contraction on their own. However, we should make it clear that IFC does not promote strengthening of muscles as well as active exercise would, but it does stimulate blood flow and it does stimulate muscle contraction when it's on that particular setting.
So common assessment findings that would indicate the use of IFC are people who report chronic pain and they can't tolerate a lot of pain during treatment. And as we talked earlier, IFC doesn't really produce too much significant pain during treatment. So some individuals who would benefit from such type of therapy could be like fibromyalgia patients because they are sensitive to mechanical stress. It could also be people who have acute injuries and anyone who has been in a motor vehicle accident. Another indication or assessment finding would be possible tissue ischemia. So these are people who could probably have Raynaud's disease or someone who has peripheral artery disease. And another assessment finding would be possible decrease in range of motion, edema, and hypotonic muscles post-stroke.
I'm going to talk to you now about some contraindications for the use of this therapy. So a big one is a pacemaker. You wouldn't use an electrical current on someone who has a pacemaker controlling the rhythm of their heart. You don't want to use this therapy on someone who has a deep vein thrombosis for fear of dislodging the clot with increased blood flow. You wouldn't use this therapy over the lumbar spine area in a woman who's pregnant because of the deeper penetration of the tissues. You might actually affect the baby directly. You don't use this on the eyes, the anterior neck, or the head, or also over major reproductive organs. You wouldn't use this on someone who had impaired cognition or impaired sensation. So someone who can't communicate with you that they're feeling an adverse effect, or also someone who just simply can't feel the altered sensation. You don't want to use it over damaged skin, so that includes wounds, scars, and also recently radiated tissue just because of the damage there. And you also don't want to use this over infection, local or systemic, or malignancy, and also undiagnosed lumps are contraindicated. In order to become qualified to bill someone for the use of IFC, there are several courses available. So many different healthcare professionals have access to these courses, and you must be a registered healthcare professional in Ontario to be able to attend these courses, or a student. As a student, you can't charge someone to provide IFC until you become registered, and then you can do that. So as massage therapists, interferential current falls under the category B of our continued education courses. So it's considered to be complementary to massage, and it's not part of your scope of practice until you have completed one of these courses. So several schools offer weekend courses. Some of them are more than one weekend long, and some courses are worth a certain amount of CEUs and some are worth more. So it just depends what course you've signed up for, but all will certify you to perform IFC. Oftentimes, electrical therapy techniques such as TENS and ultrasound and laser fall under the same category as IFC, and they can be done all together as a form of therapy. Okay, so I'm going to talk about a current research study. So we found a randomized controlled trial that talks about therapeutic effects of IFC on muscle spasticity, gait, and balance of post-stroke patients. So the results of the study showed immediate results on the spasticity of the gastroc muscle. So the therapy was applied to one group, and then a placebo was applied to another group. And the results were that the spasticity of gastrocs was significantly decreased, which helped with balance as well as gait. So this was a single trial and showed quite a bit of results for immediate relief, but further research was needed for longer term effects. It didn't seem like long-term effects were possible based on this one study, but it's very encouraging to see that it helps in the short term.